Hi, I'm Deshni Papaigari. How to discuss about this impact of telemedicine innovation in outpatient services and primary care. This telemedicine has been increasingly important innovation in the United States healthcare system. It connects patients and providers through digital platforms. Telemedicine has positively impacted US healthcare by improving outpatient and primary care. And it also has saved time and money and reduced barriers related to distance and limited local services. While telemedicine has gained visibility during the COVID-19, pandemic and relaxed regulations and temporary reimbursement changes, its growth continues, and healthcare organizations seek more efficient ways to deliver care. And this is the next slide. And research objectives, mainly to assess the impact of telemedicine on healthcare accessibility in US, to examine the cost effectiveness of telemedicine, and it's to analyze the patient satisfaction with the telemedicine services, and to identify challenges in telemedicine adoption, and to evaluate telemedicine's impact on care outcomes. And this is benefits of telemedicine, outpatient services, and primary care. Telemedicine is the delivery of healthcare through the use of telecommunications technology. It closes the gap from patients to providers. Um, the contributions of this innovation are felt most strongly in outpatient services and primary care, given the timely access to care needed for preventive health, chronic disease management, and follow-up care. Patients can contact their healthcare providers either through video calls, phone calls, or secure messaging platforms. And in many cases, it has solved the problem of physical visits. Each aspect of this approach has increased access to care in rural and unreserved areas. Moreover, wait times have been decreased and accessibility to patients and healthcare providers improved. Demerits of telemedicine in outpatient and primary care. However, its implementation requires robust infrastructure and reliable internet access and to privacy, adherence to privacy and security standards to protect patient data. And as the adoption of telemedicine grows, it continues to redefine how outpatient and the primary care are delivered. And this is systems framework analysis in the context of telemedicine for outpatient services and primary. Mostly this involves technology infrastructure, trade, healthcare providers, and policy support. And during the COVID-19 pandemic, the rapid adoption of telemedicine showed us the importance of investment in broadband access, telehealth platforms, and provider training. And despite that, access to these resources has remained a problem in rural and low socioeconomic areas, like of systems framework in this. And comparison of telemedicine to previous healthcare approaches, telemedicine has transformed fundamentally outpatient services and primary care by addressing inefficiencies built into traditional care delivery models. Previously, outpatient services were entirely built around in-person visits. It made barriers to patients with limited access to transportation, living in rural areas, and people with rigid schedules. Primary care often requires physical presence for routine consultations, follow-ups, and chronic disease management, which poses logistical challenges for many patients. Telemedicine is also eliminated the need for travel and allows patients to connect with the providers remotely. This offers a remote, more convenient and accessible alternative comparison of telemedicine to previous healthcare, whatever their approaches will there. And this is like market justice. The market justice, like traditional outpatient care models, are based on patient responsibility, access based on the availability of health providers, and the ability to pay, and the health disparity. The models generated led to the little care for people who cannot visit health facilities. In addition, telemedicine has reduced the cost of medical checkups, and telemedicine has also inconvenienced patients, like as it requires reliable and knowledge, reliable internet, like and knowledge on how to use the telecommunication software. Actually, this is social justice. And this social justice is like traditional primary care was brought up on the concept of equitable access, and however, it is sometimes limited by systematic differences such as the lack of availability of providers in undeserved communities. Like community clinics and outreach programs attempted to bridge this gap but had limited reach and resources. Telemedicine offers like a more equitable solution by allowing patients to access primary care services and regardless of their physical location. This is like economic view, and economically, like what will happen is like traditional outpatient services were constrained by inefficiencies such as long wait times, missed appointments, and high operational costs for maintaining physical facilities. Like telemedicine has enhanced the economic efficiency of primary care by optimizing appointment scheduling and reducing no-show rates and enabling providers to serve more patients in less time. Like farmings, like telemedicine is like transformational, innovative that can revolutionize, traditionalize, and outpatient services, and primary care and its adoption and expansion should be vigorously like supported. And this position is based on its proven ability to what enhance healthcare accessibility, like reduce cost and improve patient satisfaction, and particularly for undeserved populations. Besides, according to the recommendations of health professionals, like telemedicine has improved outpatient and primary care. Like finally, the conclusion is like conclusion. What I have to say means telemedicine is like an indispensable evolution in health care delivery. Its strengths outweigh its challenges by a wide margin, and making it a necessary tool to help improve outpatient services and primary care. Addressing existing barriers and integrating this service into the great healthcare system offered a more accessible, efficient, and equitable model care that meets both patient and provider needs. Thank you so much. Oh, yes. Last, I will need to discuss. I'm so sorry. References. This is like references. I just put it in this and PPT. Thank you for so much. Thank you. Bye.